everyone, and welcome to Hi-Fi Health News. I'm Erika Grotto. Medicaid is a health insurance program run jointly by the states and the federal government. About 1 in 5 people use it. The Trump administration is currently considering cuts to Medicaid funding, but just who will be affected? Joining me now is Shawn Stack, a policy director at the Healthcare Financial Management Association. Shawn, who is eligible for Medicaid? Who uses this program?
The core group of folks who typically depend on Medicaid to provide health care to them and their families are pregnant individuals, of course, parents or caregivers of minor children where they meet the income limits, children under the age of 19, low-income adults in expansion states, seniors are most medically frail folks, age 65 and older, either low-income and poorly resourced seniors or people who are in need of long-term care that is very expensive in nursing homes.
So I mentioned a little earlier some potential cuts to Medicaid funding. What's happening there?
So Congress is considering ways to shore up the debt in the country and to extend the administration's tax cuts and border security as well. So they are looking at programs like Medicaid who contribute to a lot of federal spend. And in that, Congress is exploring things like work requirements, where able-bodied adults can get back into the work climate and get employee-sponsored care. They're looking at expansion states that are utilizing a great deal of Medicaid spend, looking at maybe capping some of those amounts that the federal government is matching to support expansion in those states.
Something else the administration has talked about is fraud. That comes up with Medicare as well as Medicaid. What should we know about fraud?
Yeah, they're talking about fraud, waste, and abuse. And I think that is something that we should all be considerate of and watch very carefully where that examination of fraud, waste, and abuse goes. Working able-bodied adults and work requirements is one of those areas that the administration is really looking at. And while definitely ensuring that eligibility criteria, redeterminations are done for Medicaid recipients is, of course, something that everyone's interested in and making sure we're extending benefits to those who need them.
If you'd like to know more about how Medicaid works or how to apply, you can visit medicaid.gov for more information or your individual state's website. That's it for us today. I'm Erika Grotto for Hi-Fi Health News. Thanks for watching.